Can you tell phenotype from genotype in your genetics? Have you ever wondered if you can tell a person's traits just by looking at their genetic code? This question leads us into the fascinating world of genetics. Let's break it down together. Phenotype refers to the observable traits of an individual. This can include characteristics like eye color, height, or even blood type. On the other hand, genotype is the specific genetic makeup of an individual, which includes the combination of alleles inherited from their parents. While genotype serves as the blueprint for phenotype, it is not always straightforward to determine the exact phenotype from the genotype alone. This is because phenotype is influenced by both genetic factors and environmental conditions. For instance, two people may have the same genotype for height, but their actual heights can differ due to factors like nutrition or health during their growth. In genetics, alleles are different versions of a gene. When we look at a specific gene, a person can be homozygous, meaning they have two identical alleles, or heterozygous, meaning they have two different alleles. Dominant alleles often mask the effects of recessive alleles in the phenotype. For example, if the allele for brown eyes is dominant over blue, a person with one or two brown alleles will have brown eyes. However, not all genotypes lead to distinct phenotypes. This can happen due to genetic canalization, where different genotypes can result in the same phenotype. There is also phenotypic plasticity, where environmental factors can cause variations in phenotype despite having the same genotype. From the perspective of family genetic testing and hereditary health, understanding both genotype and phenotype is essential. Genetic testing reveals your genotype, helping to identify specific gene variants that may increase the risk for certain hereditary diseases. However, knowing your genotype does not always predict how a trait will show up. Environmental interactions play a significant role. In practical terms, genetic counseling uses genotype testing to assess inherited disease risks. Counselors consider both genetic information and phenotypic details to provide personalized advice. This is particularly important for disease prevention. For example, identifying genotypes linked to conditions like BRCA mutations allows for early interventions, even before symptoms appear. Family planning also benefits from understanding inheritance patterns. Knowing how genotypes can predict potential phenotypes in offspring can help families make informed decisions. In summary, while genotype is the genetic foundation, phenotype is the visible expression shaped by both genetic and environmental factors. You cannot always determine phenotype precisely from genotype alone. However, combining genetic testing with phenotypic assessment offers a powerful approach to understanding hereditary traits and health risks.